Welcome to Second Opinion. I'm Rosemary. If you've ever wanted a second opinion on some of the hottest topics in medicine, health, and wellness, you're in the right place. Each episode, I sit down with experts, innovators, and even a few disruptors to bring you fresh perspectives on the issues that could change your life, from age rejuvenation and brain health to the weight loss drug revolution and how to reinvent your career. Together, we'll dig into the latest research, question what's hype and what's real, and give you the insight you need to make your own choices about health and wellness. So if you're ready for a second opinion that's engaging, enlightening, and maybe even a little unexpected, let's get started. Today, I'm talking with Dr. Daniel Barone about sleep medicine as it relates to midlife and menopause. Dr. Barone is the Associate Medical Director at the Weill Cornell Center for Sleep Medicine and Associate Professor of Clinical Neurology at Weill Cornell Medical College and an attending neurologist at New York Presbyterian Weill Cornell Medical Center. Board certified in neurology and sleep medicine, Dr. Barone specializes in diagnosing and treating sleep disorders, including insomnia, sleep apnea, restless legs syndrome, and narcolepsy. He is also the author of 2 books, Let's Talk About Sleep and The Story of Sleep from A to Z, has published multiple peer-reviewed articles on a variety of topics in sleep medicine, and has been a contributor for both CNN and CBS News. Dr. Barone, thank you so much for being one of our first guests on this podcast.
Very happy to be here. Thank you for having me, Rosemary.
Great. So I was reading some things instead of sleeping. So no pun intended. I was drifting, and I read some numbers which were quite interesting. So according to the Department of Health and Human Services, insomnia is one of the most commonly reported sleep problems. About 1 in 7 adults suffer this. And what I also thought was interesting, although that number is high, but we spend about a third of our life sleeping. Is that accurate? Okay. So if we're not getting sleep and we're supposed to be steady, that seems like that could be that could be concerning.
Correct. And I always when I talk to my patients about this, I always bring up the notion of evolution, right? So when we think about our ancestors from 30,000, 40,000 years ago, right? They would be in a situation where they're in the jungle or they're in the wild, and sleeping, the act of sleeping, of being recumbent or lying down for 8 hours at a time, would put them in increased risk for being eaten by a bear or by a tiger or whatever, right? They didn't have the luxuries that we have now. So there must be something so important going on in sleep. Otherwise, evolution would have weeded it out of us, right? We would kind of have evolved to not need it. Yet we do. And we need as much sleep as we did back then. So it just goes to show basically how important sleep is for kind of normal functioning and normal health.
Wow, that's interesting. Some of our chiefs or bosses, they could be seen to be perceived just like a bear. Well, related to modern day life.
Right.
So I feel like, we've heard a lot about sleep, and
Right.
it's, but I feel like maybe broad stroking what actually goes on, the science, and then we can connect it to then what goes on in midlife. So people could understand why, maybe why this is happening.
Right. So when we go to sleep, when our brain goes to sleep, it's not like a light switch where we just shut it off and the brain goes into another form of consciousness. Sleep itself is actually very, very complicated. We know that there's different forms of sleep. So that you may have heard of non-REM and REM. So REM is when we tend to dream. What we're doing in sleep, though, again, nobody really knows the full answer, but there's different theories. So one of them is for memory consolidation, right? So sleep, not only in the short term, but chronically helps us to remember things, and also staves off things like dementia. It allows the body to repair itself, right? When we go into sleep, naturally our blood pressure comes down, our heart rate comes down. And these are things which don't really matter on a night to night basis. But if we look at over the years and decades, this kind of thing helps us to for our body to repair itself. So these are the kind of things that happen when we sleep. The answers to why we sleep, though, has kind of been an age-old question. Like what is the need for sleep? And one of the theories is that the brain actually uses sleep to get rid of toxins that would otherwise build up. Um, all these things kind of factor in to the fact that how sleep is so important for us. And unfortunately, with stress, the rigors of daily life, and other medical problems that may creep in when we get to midlife, sometimes sleep becomes a challenge.
So, with that, could you go kind of zero in even more with midlife? Maybe what could be going on that could be causing these issues?
Right. So during midlife, and this is not me saying this is the medical literature, there's increased risk for depression. There's increased risk for loneliness. There's increased risk for anxiety, particularly during these times now. I mean, we're kind of out of the pandemic, thankfully, but people are still reporting those issues, right? There's more medical conditions that happen when we get to midlife. So chronic pains, right? Arthritic pains, prostate issues in men, which will make them have to go to the bathroom. Certain medications that are needed to treat chronic problems like diabetes or hypertension can cause disruptions in sleep. So you factor in all these things, plus we're exposed to computer screens and iPads and iPhones and all these things together, I think is what makes going into midlife makes sleep more challenging.
Okay. So they're the outside factors. So, how about some of the things maybe that might be going on internally without getting too caught up in science, but maybe some basic science for some
Sure.
people out there who would really maybe that would help them connect the dots a little bit.
Yeah. I would say the best example of this is when a woman goes through menopause.
Okay.
So in menopause, what happens is estrogen and progesterone are no longer produced. And those hormones have many effects on the human body. Estrogen gives women a different fat distribution than men. So if estrogen is no longer there, what tends to happen is there may be fat deposits in the neck region, okay, and not grossly, but I mean more kind of microscopically. It can make the airway a little bit tighter. Progesterone is a respiratory stimulant amongst its many effects. So when that's no longer produced, women may not be breathing essentially as deeply during the night. Both of these things together increase the risk for obstructive sleep apnea, which you may have heard about. This is a
Yes.
condition where people essentially stop breathing throughout the night. And particularly with women, the risk of sleep apnea when they go through menopause shoots way up. Doesn't reach that of men, but it does go much higher. And what can happen is these women will come to me and they'll say, "Look, I've been the same weight I've been my whole life. I look the same as I have my whole life, but now my bed partner notices I'm snoring, and guess what? I'm waking up a lot of times now to go to the bathroom or to I'm just waking up for no unclear reasons, and it's because of sleep apnea." So I would say that probably, and especially in midlife, that was probably the number one thing I would say people come to me complaining of, and it's something we should be cognizant of.
Oh wow, that's interesting. And
Yeah.
you said that was it affect women? We were talking about weight. So
Mhm.
they were the same weight? So were they, say, maybe average weight? Or I'm
Yeah.
just curious because if you're
Right.
just, say, maybe a woman that is going into menopause that's, say, maybe a little more fit than, you
Right.
know, life, things happen. I'm just,
Sure.
that's just interesting to me.
Yeah. Well, the point I'm trying to make here is not that everybody who wakes up has sleep apnea. Not everybody not everybody who goes through menopause develops sleep apnea. But the point is just to think about these things. Sleep apnea is not necessarily a condition where people have to be overweight. We've seen it in people who are thin, who are otherwise perfectly healthy, but it's just structurally the way the airway is constructed, where the tongue sits, that that tongue may actually be falling backwards throughout the night and closing off their airway, which is what the problem is.
Oh, wow, that's interesting.
Yeah.
I wasn't even going there
Yeah.
with that
Yeah.
when I was doing
So
my
so that's one
research.
example, but I'm just saying that there are many examples where you said, internally what's going on, that
Mhm.
is that is a major one that people tend to overlook. But also too, just the hormone changes of menopause can cause women to wake up. So, um, something else to think about.
So, so that's interesting because I even have a lot of friends. I am focusing on women. There
Yeah,
are some guys that I'm going through this, but focusing on women
sure.
is that even so they're experiencing this, but
Mhm.
then even with, say, hormone replacement therapies and stuff,
Right.
now they still might. Is this maybe just because they're maybe not at the right level of medication or whatever they're doing to remedy that situation? So, because I found
Right.
that
So
interesting.
right. So yeah, hormone replacement therapy can help. That's something you definitely want to talk to your OBGYN about. But it's not right for every person, every woman. But then yeah, like if the hormones are right, then you may want to think about, all right, so could this person be, their mind is just not shutting off when they go to sleep, right? Could the increased risk of, anxiety or stress or things of that nature? Unfortunately, those go up as we get older. So these are all things which can cause women to wake up regardless of the hormones.
Regardless of the hormones. Okay, thank you. I like to blame everything on hormones.
Well, I mean, it's yes,
I'm
it does play
teasing.
a role. Yeah, it plays a role, sure.
Okay, so we talked about the hormones, right? That's a separate conversation, but there's also a lot of discussion about sleep hygiene.
Right.
Can you share some realistic tips for somebody struggling with during these transitions?
Sure, sure. So we have now, unfortunately, with the devices that we have, the computer, the TV, the smartphone, the smart devices, we're exposed to what's called blue light. Okay, so blue frequency light, you may have heard about. What that
Mhm.
is the light that comes from screens. Okay, it's in a certain range. And what happens with blue light is the brain recognizes that light and thinks to itself, okay, the sun is out right now, so therefore I must not need to go to sleep. Okay, that's the simplest way. So what happens is when we're exposed to blue light, these type of devices, our brain shuts off melatonin. Melatonin is normally made when the sun goes down, and that tells us it's time to fall asleep. When we're exposed to blue light, especially before bed, the shut off of melatonin can make it harder for us to essentially go to sleep. Okay, so what happens nowadays is we have what's called social jet lag, right? So it's like we're kind of up late, our eyes are exposed to this blue light, and that can kind of make shift our schedule later than what we want. Okay, so when we talk about sleep hygiene and good sleep habits, sleep hygiene doesn't mean the bed is clean. It means the
Right.
habits are clean, right?
Yes.
So what we recommend is people take at least a half an hour before bed to kind of give their eyes a rest. So what you can do instead of using a screen would be to listen to soft music or a podcast like this, right?
Right.
Or meditation is one of my favorite things. Okay, or read on paper. Okay, like we used to. These are all things that you can do to kind of give your eyes a rest, give your brain a rest, and tell your brain that it's time to go to sleep. I would say
And
that's probably the biggest thing that people can do.
that we're really suffering with
That's right.
today in
That's
today's
right.
day and age.
That's right.
Um, Actually, I had a personal question too, because during the day, so say people who tend to get up early, they'll have coffee in the morning and they don't necessarily maybe drink it all day, but later in the day, say if they want to hit the gym or something after work. And so they need something just to get them through. Let's face it, it's low in calorie. It's kind of like the good go-to if you don't really have the time to eat a meal and so forth. Somebody grab a cup of coffee. So, is that because I've read many different things from all different doctors, about what time to stop drinking that, as opposed to eating a snack before going to bed, all these different things, but basically the whole caffeine. Is it if you say drink a cup of coffee late in the day, but say you do use that to go to the gym or you do burn that off? What are your thoughts on that as far as sleep?
Right. So it's a great question, and honestly, the answer is more individualized than you think. So caffeine can have a half life up to 5 hours in some people. So
Okay.
what a half life is after that period of time is over, half of the substance is left behind in the body. Okay. So if that means if somebody has, let's say, a cup of coffee at 5 p.m. and they're doing something good for it, they're going to the gym, they're working out, that's just great. The problem, though, is when they try to go to bed at nighttime, it's possible the caffeine is still in their system. Even though they don't necessarily feel the burst of energy, the brain recognizes caffeine is still present, and that can be enough to make it harder for them to fall asleep at night. So what I
Okay.
usually recommend, and again, this kind of depends on the person, but I would say if anyone has any trouble sleeping at night, I would probably say by 1, 2 o'clock, caffeine should be the latest.
Should be the latest.
Yeah.
Okay. Yeah, because a lot of people, coffee's an experience too.
Right,
It's
right, exactly. Yeah.
right. So it's just, and a lot of people I know that was like a question for
Sure,
them
sure.
as
But
well.
let me just I just want to qualify that for one thing. So so
Sure.
so even decaf coffee has a little bit of caffeine in it. So you got to be careful about that. I know I've made that mistake myself. Unless it says caffeine free, I would say 1, 2 o'clock.
Great. Thank you. How
Sure.
about even if you say get hungry before you
Mhm.
go to bed? Because
Right.
I've read that it's, have some protein or something before you go
Sure.
to sleep, but then that could also disrupt your sleep.
Right. So the rule with that is you kind of want to go to bed not too hungry, right? So you don't want to be starving. We have hunger pangs, but you also don't want to go to bed with your a belly full of food, okay? Because that both of those situations will wake you up. What we usually recommend is if you are hungry before bed, maybe a little snack, like a little bit of protein, like maybe peanut butter or so, a little bit of carbs and protein. Cracker with peanut butter would be fine. Those are the kind of things. But again, it's kind of a delicate balance. You don't want to gorge yourself, of course.
Right. Too much.
Right.
Thank you.
But yeah.
Let's see. So, okay. So, what would you say? So, in your books, both of your books, you do talk about disorders, insomnia, and sleep apnea.
Right.
What would you say to somebody who might suspect that they have a sleep disorder, but they're not sure?
Sure. I think the bar these days should be pretty low. You definitely want to talk to your primary care doctor and see if there's something that's, low hanging fruit that you can improve upon. For example, if somebody's waking up frequently to go to the bathroom, something as simple as, okay, well, maybe stop drinking liquids an hour or two before bed, that may be all they need, right? But if you do all the quote right stuff and are still having trouble, I think you want to go get yourself at least tested. And these days, there we have home sleep tests, which are pretty benign. Really, it's just the one that we use here is we just have basically a device that goes on the wrist. The person wears it for 2 nights, and while it's not 100% accurate, it gives us a sense of is this person having sleep apnea or not.
Interesting. So,
Yeah.
you're suggesting they start with their healthcare provider first,
Hmm.
because I know there's a lot of information that circles the internet too that might not necessarily, because I've even seen like patches and all these different things. Right. So just start with your doctor and then I guess, do the appropriate testing to see then how to move forward.
So, I mean, there are gradations to how severe a sleep problem is, right? So if somebody's bed partner says, "Hey, listen, I hear you choking throughout the night," that I think would be all right. Look, this could be sleep apnea. Go get tested as soon as possible. Whereas if it's occasional difficulty, initiating sleep, I think reading a book such as mine, it might be
Good
helpful
plug.
to yeah to get some good tips, and that may be all they need. But I think if they do all the kind of right stuff first, and none of that is working, then I think you want to talk to your provider
Okay,
and go
great.
through. Yeah,
Thank you.
sure.
So, is there anything coming down the line as far as new research or any kind of treatments that you're excited about that we might not know about yet?
Right. So for the classic obstructive sleep apnea and insomnia, those are constantly in the public awareness because there is always new things that people are at least um, purporting to investigate. Sleep apnea, the kind of gold standard is a CPAP machine, and what
Mhm.
that is kind of a mask that people wear over the nose or the nose and the mouth. Sometimes they call it a Darth Vader mask, but basically, what the CPAP does is it blows pressurized air into the airway, which then forces the airway open with pressurized air. It does work, but people don't like it necessarily in some cases because they feel claustrophobic or they feel anxious. So there are companies and investigators trying to figure out ways to treat sleep apnea without a CPAP machine. As it is right now, we have dental devices which pull the lower jaw forward. Those can work. You may have heard about the Inspire device, which is a nerve stimulator that gets implanted into the chest. And what that does, it sends a signal for the tongue to stay stiff throughout the night so it can't fall backwards and close off the airway.
Oh,
Um,
wow.
yeah, but there are people working on medications now, believe it or not, a pill to take at nighttime, which may reduce likelihood of sleep apnea. So I would say this is a pretty exciting time in sleep because investigators are really trying to hone in on the biggest problems there are, which are insomnia and sleep apnea, which are rampant in this country. So I think we're heading in the right direction.
Yeah. Well, even, it's like just working in healthcare and things like that. And just, we have these conversations all the time too, because quality versus quantity, it's like, ideally you're getting quality and quantity sleep, but
Right.
I mean, and I guess one would affect the other, I guess, essentially, but what could we do better or where we go? I mean, you said the blue light, where we going wrong, but what
Right.
could we maybe start doing today to maybe improve the quality of our sleep? Or what are your thoughts on that, quality versus quantity?
Right. When somebody says, I want to improve my sleep, what I always say is there's actually three things. So there's quality, right, which is if there's a sleep disorder, taking care of it, like sleep apnea, I keep talking about. So there's quality, there's quantity, right? So the National Sleep Foundation has put forth we need 7 to 9 hours. The average adult needs 7 to 9 hours of sleep, but also timing. So you have quality, quantity, and timing. Okay, and the timing part is important because we talk about circadian rhythm, right? What does that mean?
Mhm.
This is basically the brain's internal clock that tells us this is the time we're supposed to be asleep, and this is the time we're supposed to be awake. And that plays its role, like for somebody who works overnight. My wife works overnight at the hospital every few days, every few nights. And what can happen is she comes home from work and she's exhausted, right? And she will sleep, but we know the quality of the sleep in from the morning hours into the evening is not as good as it would be in the evening until the morning, right? We know
Right.
that, and the body is not kind of adjusted to that. So no matter how, even if she has great quantity and great quality, the timing is off. Okay, and that can happen for people on a smaller scale as well. So, for example, if somebody tells me, I start getting tired around 11, and I think my body wants to wake me up around 7, but I tend to stay up later than I should. I stay up later to like 1 o'clock or so playing video games or so, and I still get my 7 hours, but I don't feel as good as I want to. In that case, I would say their circadian rhythm is probably telling them to go to bed earlier and wake up earlier.
Interesting.
Yeah.
And is this true? I've read, I don't know if how accurate this is, but
Mhm.
your body, the earlier you go to bed, because your body is actually your sleep, that's when you start repairing yourself, whether your liver, your brain. There
Right.
are certain times when that starts to happen
Well, it's not so much, oh, my liver is ready to sleep.
at 10 o'clock.
It's more. I think it's a global signal in your body telling you, hey, you've been awake for enough now. It's time for our organs to kind of repair themselves. But it's really the brain that drives everything.
I see. So
Yeah.
it's not necessarily better to say go to bed by 10, or somebody's more of a night owl and they stay up till
Mhm.
midnight. But if you get the same amount and quality, that's what's more important.
Well, it's different
Or
for every person, right?
different for every person. Okay.
So there are some people who their clock is literally set later. So instead of,
Okay.
let's say, 11 to 7, their body really is telling them 12 to 8 or 1 to 9. Now, if they're able to kind of exist with a job or with school in that paradigm, then that's great. But a lot of times people are kind of fighting against that, in which case, they kind of get misdiagnosed as insomnia, when in reality, it's just their body's clock is telling them this is the time to sleep. So it depends on the person, the situation.
Okay. And
Yeah.
then with that, some of my midlife friends from work, both in news and in the hospital,
Right.
they had two burning questions. One
Mhm.
was, well, one you sort of answered with the time and their brain function. A lot of them are
Right.
just all concerned about keeping their faculties as long as they can.
Right. Yeah.
And also, which I didn't think about, was their microbiome, if
Mhm.
that's
Right.
connected to your sleep.
Right. So the microbiome question is super interesting, and I think that will be answered in the coming years. We definitely know the gut and the brain are connected. Okay.
Hmm.
And if you look at which is really interesting. So there's more nerve cells in the gut than there is in the central nervous system. Okay, which is a fascinating uh,
Wow.
finding. So where that kind of lies with sleep and how what we eat and all that, we don't really know the answers yet, but I think in time that will definitely be parceled out. Both how we sleep, how it relates to how it affects the gut biome, and how the biome affects our ability to sleep, and vice versa.
Oh,
We don't
wow.
know that, but it is definitely coming.
Oh, wow. So could that be something that people could, even so in midlife, as we get older and our, microbiome has kind of been through it, would that
Right.
be something, I guess, maybe overall sleep and just overall health that could possibly help? Or is that a stretch to say?
Yeah, it kind of goes back to the question we were asking before, right? Which is like, what is the point of sleep, right? When we started this, we said, what was the point of sleep? It's must be something that's so important that the body is kind of repairing itself. Um, I think we're going to find that sleep and brain health are so closely tied to not only the gut biome, but the entire body. The entire body, mind, and spirit. I mean, for lack of a better term. We don't have the answer yet, but I think we will in time.
It's funny, like to circle it back around to midlife, we realize it's just all overall health, just like our weight, our sleep, our diet. It's just not to be, thin or, be able to lift so much. It's just all work, how it's so interesting how it all comes together. Like you might do one thing, but if you're not doing this other thing right, like I feel like sometimes sleep anymore. Like, I wish I knew this in college because I
Right, right.
stayed up,
Oh,
I'm
I hear
sure
you.
you in medical school, like
Right.
we stayed up, and even like women who might be, trying to stay up late to get things done, you're dealing with, your kids or aging parents, or heck, you might be back in school at 40 or 50. You never know. And it's like, at the end of the day, like now I know, I'm like, I'm just going to bed. Nothing's going, it's like I'll function. It's not, I can't read anymore. I can't prepare anymore, or I can't, just go to bed.
Right. Well, it's one of those things where we're designed to be able to do that occasionally, right? That's not
Hmm.
a bad thing. We look at in terms of sleep, we look at things, long term, right? So
Right.
a night here, a night there, or poor sleep here, it means nothing in the grand scheme of things. But we're looking at more kind of over the years and decades.
I
People
see.
always ask me, I want to stave off dementia, right? What's what I can do? Quality sleep, quantity sleep, timing, right, and exercise.
Hmm.
I think those, that's kind of the as easy as it sounds. That really is kind of what we know. Um, you know, Poor sleep can affect memory short term, but if we don't get good sleep over years and decades, the theory goes that the brain is not able to kind of get rid of those toxic byproducts that get left behind, and that can lead to neurodegenerative diseases. So, um, that's kind of, I would say, the crux of everything right now.
Right. So clearly it's best to try to make these changes, as early as possible.
Definitely, definitely.
But is it too late? Like, say if you are, midlife and so forth. I mean, is there still a shot if you start taking, making better choices now that you can help chronic disease and things like that?
Undoubtedly, and actually, there's data being put forth, practice parameters and guidelines for both providers and for patients that in midlife, if you can start really making good changes, the risks are mitigated down the road. So dementia, chronic diseases, all the things we talked about. So it's definitely not too late. And If you're someone who's thinking, okay, I should be tested or should be evaluated for a sleep disorder, absolutely do it. I don't think there's any other time than now.
Okay. Well, and just a few more things before we wrap up, because I'm interested as well. You touched on supplements a little bit, and then you kind of went off of it, but I feel like there's just so much out there, right? Even just with melatonin, and there's this L-theanine, and I have something sitting in front of me that I take, with a bunch of different, I take magnesium at night, for multiple things. What are your thoughts on supplements, and how should people approach that? Because what if melatonin is not even the issue? I don't know. It's like you could be taking melatonin, and uh, yeah, if you would like to share upon with that.
So no, I have no problem with supplements, and I think that
Okay.
in the right situation, they're perfect. What you hear though about is people say, "Oh, you shouldn't take melatonin for this long time." Or I would say this: the rule that I have is you don't want to use any supplement as a band-aid, right? So if somebody, let's say, is waking up many times throughout the night, the bed partner hears them snoring, there's a high risk of sleep apnea. I would not be popping melatonin in that case to try to stay asleep. I would go get it tested and get evaluated for sleep apnea. But in the right case where somebody has, informed their doctor and everybody's on the same page, sure, trying melatonin can be very, very useful. In fact, if a patient of mine comes to me and they haven't tried anything yet and they don't want to go the route of medications just yet, let's try melatonin. I usually say if it's trouble falling asleep, immediate release melatonin, a few, up to maybe 5 milligrams. If they have trouble staying asleep, then time release or extended release melatonin can be a great option, or even a complementary treatment. So melatonin is by far and away my most recommended, but I also recommend magnesium. Magnesium has been shown to reduce central nervous system activation. That can help people be a little bit more relaxed before sleep. But those are just two. There's many others. There's valerian, there's L-theanine, as you mentioned. Some people use ashwagandha. You know, I mean, the important thing is you just got to tell your provider what you're doing and make sure that you're not overdoing it. With melatonin specifically, I really wouldn't go above 10 milligrams.
Really? Okay. Because they make the gummies and they make it very easy, but don't take more than 10.
Right, right.
Okay. So with that, a lot of people, if you fall asleep and say you wake up at, say, you go to bed at like 10, and then you wake up at, say, 1, 2, or even midnight. Sometimes you might only sleep 2 hours, especially in midlife. What is something that people can do to maybe fall back to sleep?
Well, I'm a big believer in meditation. Like I said, I think having a relaxation technique, going right to that would be paramount. I would also advise against looking at a clock. Okay, so if you do wake up, I know the temptation is there to see what time it is, but especially if you're hyper focused on that, that can make it harder to get back to sleep. I would also wonder too if somebody is going to bed at 10 and waking up at, let's say, midnight, they may be going into bed too early, believe it or not. So it may pay for them to delay the bedtime a little bit to maybe 11 or so and see if that plays a positive impact.
That's interesting. So here
Yeah,
you think you're going to bed early,
right.
but that could actually be counterintuitive.
It could be that the brain almost thinks of it as like a nap, right? So you go to bed at 10, you wake up at 12, it's a 2 hour nap. And then at that point, it's impossible to get back to sleep, because you've already kind of gotten a little bit uh or gotten a little bit of sleep pressure you've already eliminated. So
Oh, interesting. And I guess if that's the case later in the day, like you said, minimize the blue light. Don't go into the things that are actually going to keep you up. Just maybe do the things that are going to keep you relaxed and so forth, but stay awake. Oh, that's interesting. Thank you. That was really helpful. And just two more things. Do you have a sleep routine since you're the doctor?
yeah.
Most people
Well,
who practice don't
yeah, the old adage is true. Doctors are the worst patients. So I,
have.
you know, I'm not terrible. I mean, I do pretty good. I'm a gamer, so I do like to play my games. I have to kind of condition myself though to say, all right, half an hour, let's stop it. So I'm pretty good at that. I would say, yeah, but I'm okay. I think probably that's my biggest sin though is video games too late.
Nice. Well, and how about your wife? Would you mind sharing? I don't,
Yeah,
since
yeah.
we are talking about women as well, like, does she have
Right.
anything that maybe that people could benefit from?
No, she's a very relaxed person, which I think does help her. She works in the medical field, but she's very relaxed, and I think that helps her to sleep very well.
Good, good.
Yeah.
Well, thank you for that, for sharing that. And so, lastly, how can people find your books? Are you taking patients? Are you accessible if some people are watching who are not in the New York area? So
Yeah.
let us know.
So yeah, my books are both on Amazon. Roman and Littlefield is a publisher. Let's Talk About Sleep came out in 2018, and that's more of a kind of narrative story. So if somebody, let's say, wanted to read about insomnia, they would read about these different patients, kind of telling their story, and then me kind of interjecting. So it's a little bit more. It's I think it's a little bit easier of a read, whereas the story of sleep from A to Z, that's more of definitions. Again, it's written in a very patient friendly style, very easy to understand, but it's more kind of like, all right, I want to know about melatonin. So let me read the entry on melatonin. So there are two different ways of kind of, reading about the same stuff, but I think both are very helpful for people. So,
Thank
and
you.
as far as, yes, I do take patients. I'm at Weill Cornell in Manhattan. We have a 6 months wait list, I believe. So I am available, but pretty booked.
Well,
Um,
that's good.
yeah, yeah,
That's great. And
yeah.
is there anything pertaining to midlife, a concern, or that I didn't ask you that maybe you wanted to make sure that you shared today?
No, but I know I think we got the important points, but I don't want to belabor this point. Sleep apnea is more common than we think. 24% of men,
Interesting.
9% of women. So if there's, I would say that's the lowest hanging fruit, particularly as we get older, into midlife, postmenopausal women, particularly as I said. If there is any risk for that, get tested.
Great. Thank you so much. That's
Sure,
really helpful. Thank you.
sure.
So, and that's a wrap for today's episode of Second Opinion. A big thank you for Dr. Daniel Barone for sharing his insights how sleep impacts our health, especially in midlife and menopause. I hope you've walked away with some useful tips and a fresh perspective on how to improve your sleep. If you enjoyed today's conversation, don't forget to subscribe, rate, and leave a review. It helps others to find the show. And if you have a topic you'd love for us to explore, drop us a note. We're always looking for new ideas. So I'm Rosemary Belts. Until next time, take care of yourself and get some rest. And remember, always get a second opinion.